everyone. I am Jordan Huckabee, and this is Dr. James Wiernas here to talk with you and discuss a few interesting topics that we hear from you all the time. One thing that we really want to cover, because we have been looking at women's hormones for years and years, and there's such, I think, a community who wants to know more about women's hormones and what options we provide. So today I'm going to go through two specific questions with James that I know you have all been asking. But the first one I want to talk to you about is, James, what is, I guess, compounded hormone medications, and what does that mean for women specifically?
Compounded is a very broad term, but that's what we specialize in, and that's one of the beauties of having a compounding pharmacy is having the ability to make what we need customized for the individual. So we can make, with hormone replacement therapy, a lot of what we're doing is be it oral capsules, it could be topical preparations that they can apply to their skin. It could even go towards the a pellet potentially. There's the sky's the limit, but it really just it's all going to kind of going speaking generalities. That's some ideas of the dosage forms, but it's going to vary based off of what's going on with the patient and where we specifically need to address those different dosage forms.
So what would be some, I guess, if a woman was wondering if she was a candidate for hormone replacement, what would be some signs or symptoms to look out for?
Well, first thing, foggy brain would be a good thing. Memory, potential memory loss. We definitely want to be looking at the skin. The dexterity or the elasticity of the skin could potentially be something that we're looking at. Brittle or dry hair could be another thing we could look at. That sometimes could morph into whether it's sex hormones or it could potentially be thyroid related. But either way, that's something that we need to be looking at. As far as triggers, energy level is definitely something that is consistently discussed with a lot of the patients that we talk about. Their libido obviously would correlate to that as well. And then vaginal dryness could be something that is commonly discussed. We obviously need to evaluate that from whether it be their OB-GYN or their PCP, their primary care physician. Would need to discuss those different things. And obviously the first start would be to discuss that with them and get labs drawn. Okay.
So I guess the biggest part too for understanding from a woman's perspective and going in with all of this is that they can come to the pharmacy and do these consultations with you or another pharmacist to kind of understand where they are and then potentially help find a physician to work with them as well.
One of the beauties that we have the luxury of with having such an established pharmacy and having the reputation that we do, being basically in the community for 30 years, is that we've built those relationships with a lot of the physicians that we have the ability to do saliva tests at the pharmacy. And on top of that, we can give recommendations. By no means are those prescriptions, but we can give recommendations to the physicians at the discretion of having a consultation. Usually it takes anywhere between 20 to 45 minutes that will have the ability to have a pharmacist sit down with that individual patient, listen to their needs, look at their labs, and make a recommendation individualized to that specific person, which is extremely helpful for establishing that triad with the pharmacist, the physician, and the patient to where they can get what they need specifically. And it's a win-win because the physician can utilize that information that we have and the knowledge base that we have, and they can use it at their own discretion. They don't have to follow exactly what they want. And if they want to discuss it with us, we're always just a phone call away.
Awesome. So you spoke a lot on this, I guess, individualized approach. And that's, I think, what we do all day long is we're looking at the person because we're all different. You go home to a different life than I do. So we've all got different stressors. But I know that many people kind of want a simplified version. So can you give us 3 supplements for women? I think that this is something that women are always asking about. We provide so many supplements, it can become a little bit confusing. But what 3 supplements would you always consistently recommend for women?
Well, there's a number of supplements that I would recommend, but if I had to narrow it down to 3, magnesium, DIM or diindolylmethane, and omega-3 would probably be my top 3 supplements that I would recommend for women's health. Diindolylmethane is you could also, lump it in with cruciferous vegetables. Mm-hmm. That is not something that everyone is always going to be putting in their diet, but they are extremely important. Mm-hmm. So you think of your green leafy vegetables, your things like cauliflower and other items like that. Mm-hmm. But the main thing that we're really getting at it when we kind of talk about with women's health has to do with estrogen metabolism. And they also ties into aromatase. So the thought has to do with, it definitely helps with estrogen metabolism, and they also ties into keeping with some of that extra, it's basically balancing the hormones. Okay. So looking at it to balance out the hormones and also to help clean out some of that excess. The DIM is, they go through, and without getting into too much science, but they definitely get concerned about excesses of certain metabolites with regards to whether it be the 4-hydroxy and the 16-hydroxy estrogens being harmful. That's you think of the cancer-causing type metabolites when they relate that to estrogen excess. So that's definitely something that we want to be cognizant of. Omegas, omega-3s, extremely underutilized supplement. I could recommend it to everyone, but really in relation to women's health, extremely huge with inflammation. Mm-hmm. Inflammation is important for everyone, but they've tied it to a lot with cognition. So memory recollection and mental clarity. Mm-hmm. So in relation to that, who couldn't use a little boost to that in any day, right. Whether that's one of my kiddos or whether that's Miss John that's just wanting to remember a little bit more of her medicines or something like that. The last one being magnesium. I know we carry a magnesium glycinate that is extreme. I can't tell you how many people that it's positively impacted with sleep, but not just with sleep. It also is helping with joint pain, discomfort, as well as just helping with overall wellness and deficiencies, because magnesium deficiency actually is quite common.
Yeah, I think I actually read something one time that said about 73% of Americans are deficient in magnesium, which is kind of wild if you think about it.
Not surprising, unfortunately.
Yeah. All right. Well, great. So thank you for giving us those 3 different supplements. I think that you would also reiterate the importance of the pharmaceutical grade as well, which is what we offer in our pharmacy, which is something that is, not going to be filled with the junk you typically find, like fillers and binders and impurities, and it has to actually contain what the label says. So that's another important piece, is the pharmaceutical grade too.
That's an extremely good point. I'm glad you brought that up, because in relation to being able to stand by your word, stand by what you're selling. That's one thing that we definitely have always done a really good job with vetting the companies that we carry, and we mean what we say when we're saying we are a pharmacy, therefore we are carrying pharmaceutical grade products. We're not just going to buy the cheapest products just because of price. If we're going off of that, then we don't even necessarily know exactly what we're really getting out of the products. And I know, not even probably more than 8 years ago, there was a number of companies that were pulled off of certain stores because they literally were giving them placebo pills, and there was no vetting of that. A lot of the pharmaceutical companies, as far as nutraceuticals that we carry, conduct testing, whether that's internal or external, to verify the legitimacy and the accuracy of what they're making, similar to what we have with our testing procedures that we do in-house, similar to what the FDA will hold large manufacturers of those products.
I'm glad you touched on, that pharmaceutical grade supplements also are kind of what you guys do in the pharmacy and the structure behind that. So
it all comes around full circle in some way or shape or form.
Awesome. Well, thank you for all of your information. I know there are tons of women who will appreciate this and be thankful that you've gone over some of these points for them. So if you guys have questions or you have more specific concerns for yourself, please contact the pharmacy for more information. James and any of our pharmacists will be happy to help you.